Hello, hello. Welcome back to Sapien Podcast. Today we have another good one with Dr. Gabe. We've had him on before. We did it in person, and now we're back to ask him some more questions, get into some more vitamin D topics, all kinds of stuff. How's it going, Dr. Gary?
Brian Sanders, thank you very much. Thank you, everyone, for listening. We have one of my best friends on today. So, as some of you might know, Brian Sanders, one of my best friends, Dr. Gabor Adorjan, another one of my best friends. Dr. Gabe is a dentist. We've had him on the show before, and we went pretty deep on vitamin D. And what we decided to do this time is focus on sleep apnea. So as you guys know, I'm an internal medicine physician. My practice is in Woodland Hills, and Dr. Gabe has a dental practice just about 5 minutes from mine. Me and Dr. Gabe got connected years ago, actually through social media, through Peak Human, through my work with Sapien. We're super like-minded when it comes to health, but also when it comes to living our lives. And we've slowly started working together as a sort of a non-formal sleep restoration program. What I mean by that is patients come to me uh, when I have a suspicion for sleep apnea, which I do more and more these days because I've become far more aware of it. Rather than sending them to a sleep specialist, I actually send them to Dr. Gabe. Dr. Gabe is able to look at the airway, the teeth, the tongue, the neck, do a physical exam in addition to sleep studies, which he's able to do through novel technologies available to us. And through that, we're able to help people either get a CPAP, either get an oral appliance if they're positive for sleep apnea. We also do a lot of supplementation work, which can really help. Anyhow, we get deeper and deeper into it, and we actually talk about a number of our patient, a lot of clinical kind of vignettes. And I think this is interesting for everyone because so many of these stories are going to be similar to your story or your loved one's story or someone you know. And the idea is that sleep apnea is such an unrecognized, underdiagnosed issue and often a root cause medical problem for metabolic disease, obesity, diabetes. A lot of problems come from not being able to sleep at night. And so we're really excited about this episode because we hope it will strike a chord with some of you and maybe motivate you to go get your sleep study done. So yeah, really excited. And you can also, in the podcast, you can reach out to Dr. Gabe. His practice is growing and he's doing some great work out there.
Absolutely. Sleep apnea is so huge because you don't have to be obese to have it. You don't have to be old. You don't have, anyone can have it. Anyone can have small, like smaller versions of it. And so
Mhm.
you should just check it out. It definitely affects your metabolic health and it will affect your blood sugar regulation if you're not sleeping well. And I've known people that have done all the right diet things, still had some problems with their weight, still had some problems with their metabolism, fix their sleep, game changer. Game changer. So
Absolutely.
let's leave it for the episode. But this is a good one, guys. And before we start, I encourage everyone to go to evolvehealthcare.com, check out Dr. Gary. I would say best doctor I go. I always lead people to you when they ask me because you do remote consultations and you understand ancestral health and you just are no nonsense, right? There's so many food lies. There's so much, propaganda going on out there. Gary sees through it. So
I
good
mean,
doctor to
I
have.
I appreciate it, Brian. Obviously, you're biased because whenever anything happens, I get a cell phone call from you. Gary, what's but in all honesty, I'm really proud of the work I do, and I appreciate that, Brian. And we're going to keep going. The practice is growing. I'm bringing and training new providers, and it's just really lovely. Um, and in the meantime, you guys should also think about checking out Brian's Nose2Tail.org. I really think it's probably the best meat company delivery service that I've ever tried, and I've tried a bunch of them. I'm a consistent player with the Primal Light product, which is the organ meat mixed with the muscle meat. I actually make Russian kotlety. I don't know if I've ever mentioned it on the podcast, but
Mm.
anyway, they're little Russian meatballs. Put like onions and herbs and sometimes even a little rice breadcrumb to stick it together, kind of like a meatloaf, but like little guys.
Mhm.
Anyhow, you guys check it out. He's got other products, skincare products, seasonings. But look, we love it. Keep it up, Brian. I know it's hard work to procure the high quality food products. So we
Oh man.
appreciate you, man. We appreciate you bringing that to the masses.
It is hard, and that primal ground beef is. I mean, we can't get enough organs. Right now, I'm trying to figure out some more organs so that we can make that ground beef because everyone loves it. It's like, well, I think it's our best product by far because it's the best way to get organs in your diet without having to resort to, I don't know, desiccated pills. I know people sell those, and those are fine in a pinch, but got to eat it.
I mean, it's the kind of product that needs to be on store shelves. I mean, it's a no brainer, and I think in the future, organ meats and sort of this nose to tail approach must be the way we go because as the food supply becomes more limited and as we further understand our world, we really have to go back to that idea of eating the whole animal, using the whole animal, doing things sustainably. And so not only is it obviously incredibly healthy for you to consume that food, it's also just the right way to approach eating animal food. So anyway, you guys check it out. We're excited to share this episode with you. And we got more coming. So thank you again. And without further ado, Dr. Gabe.
Hey everyone, we're back with the Sapien podcast. We're back with Dr. Gary and we're back with Dr. Gabe for the second time. We had a great episode with him. We got some listener feedback. We want to go into some more detail, specifically some sleep apnea stuff. This stuff is super important. It's not only for older, fatter people, as some people think it could happen to anyone. And I'm going to let Dr. Gary go into a little bit more detail. But first of all, hello, Gabe.
Hey, how's it going, guys? Nice to be back.
Dr. Gabe, thank you so much for joining us. As usual, I'm very excited for this episode. This issue of sleep apnea keeps coming up, and it's something that has become just really prevalent in my practice. And me and Dr. Gabe have been working together. Dr. Gabe is a dentist, but really, I think of him as a holistic healer in many ways. He looks at the totality of human health. And he just looks at it through the portal of the mouth. That's his specialty. But Dr. Gabe and I do a lot of sleep restoration together, and it's something I'm really proud of. So today, what I want us to focus on is sleep apnea. I want to talk about what it is. I think there's a lot of misunderstandings about what it is. We're going to talk risk factors. We're going to talk about what me and Dr. Gabe see in clinic and sort of what may hint to a diagnosis of sleep apnea or what makes us think about kind of pursuing a sleep apnea workup. And then we have a number of clinical case vignettes that we want to go through. Dr. Gabe and I have been treating patients for the last few years, and we've got some kind of model patients that we're going to talk about, kind of patients that you guys, the listeners, might relate to, and maybe it'll ring true. And then you guys can kind of see if this is something that is a problem for you. And at the end, we will go into some of the treatment options for patients with sleep apnea. So let's get started. The first thing is, what is sleep apnea? I think so many people misunderstand that. So Dr. Gabe, can you give us a little rundown?
Yeah, absolutely. So there is a spectrum, I guess you could call it, of severity. We'll start with basically UARS. You can think of as the baby sister of sleep apnea. In essence, UARS means upper airway resistance syndrome. And the common misbelief is sleep apnea is the person stops breathing. And when you tell people they may have apnea, there's usually a response from them saying, "Oh, that's not me. I don't have apnea." People are very certain when they respond, never have to take in a sleep test, and it's almost kind of like what we talk about that people often relate sleep apnea with obesity and being overweight, and URS is basically where it starts. With URS, the person doesn't necessarily stop breathing. It's enough that there is some resistance to the airflow. So when the air passes in and out, it doesn't pass through freely. And this is a person that when you hear them sleeping, you can just hear them breathing. And that's not supposed to happen. So The symptoms people get with URS are different than apnea. And basically, what happens is when somebody has this upper airway resistance for a long period of time, the basically body starts to break down. You lose your restorative sleep, or at least it's not as restorative as your body needs it to be. And then the airway gets worse, the muscles get worse, and then it progresses to sleep apnea. With sleep apnea, the way they score it is something called AHI, which is an apnea hypopnea index. And apnea, the Latin meaning is without breath. So with apnea, the person stops breathing. With a hypopnea, that just means there's reduction in airflow. That's the basic kind of definition and concept of apnea.
Yeah. And I think the distinction we want to make for everyone is this idea of obesity hypoventilation syndrome versus sleep apnea. At least I think that's an important distinction. So many people just think, well, if I'm not super fat and I don't have sleep apnea, because we have this idea that's really a traditional idea that we used to call in medical school Pickwickian syndrome, which is, I think, from a Swift novel where they have these characters that are super heavy and they're sleeping all the time and they're snoring all the time. And this sort of became the model of what sleep apnea looks like. But it turns out that there's a number of mechanisms that limit your ability to breathe at night. It's not just, the physical obstruction of your airway due to obesity and a fat neck or a fat tongue. Those are the only things people think about. There's a number of vitamin deficiencies, which we'll get into, that contribute. There's even an idea that a vitamin D deficiency with mom while baby is in utero can contribute to malformation of the jaw, which contributes to sleep apnea. Um, so it's really, as Gabe said, a more of a spectrum disorder where there's different levels of this inability to breathe, and there's different causes for that inability to breathe at night when you're sleeping. And all of this is extremely detrimental to a patient's health, causing a multitude of comorbidities, which again we'll get into and give you guys specific examples. And the last important thing really to remember is that in the world of Western medicine, we really have one tool. We have the CPAP machine, which is a machine that sits on your face, pushes air into your nose and airway or mouth and airway while you're sleeping. But it turns out there's other interventions that should be tried and considered once that diagnosis is made. So I hope that clears up the difference between obesity hypoventilation syndrome and the broader term of sleep apnea. Dr. Gabe, can you get into some of the risk factors, what people with sleep apnea, comorbidities or factors that increase your risk for sleep apnea?
Well, as you mentioned, definitely one of the risks is weight. And the common misconception is that, oh, you only have apnea if you're overweight and you have a certain neck circumference. That's one of the tools they use to measure is they measure your neck. What's your shirt size, an 18, a 19. And that is definitely a risk factor, and that's all it is. There are some people that are overweight that don't have apnea. There are some people like myself that have never been overweight and have apnea. So it's really obviously the other common misbelief is that it's very largely structural. So people that have an underbite, for example, that means that the upper jaw didn't develop as much as the lower jaw, and how that's going to affect you is the upper jaw is basically the floor of the nasal cavity. So if you have constriction of your upper jaw, you may have issues with upper airway, breathing through your nose, things like that, deviated septum. If the lower jaw doesn't develop fully, then you have an overbite. That's what I had, and the lower jaw is what houses the tongue in essence. So when you have a very underdeveloped lower jaw, that can kind of push things towards the back of the throat, cause obstruction. Really, the the things that cause obstruction, right? We talked about upper airway, the septum, but the basically it's the movable soft tissues in your mouth. So your tongue, your soft palate, and and um, and the uvula. Those are the things that we kind of see being affected in people that snore and that have apnea. So there's definitely structural issues that contribute. And the common misbelief is that weight and structural issues are the main things that affect it. What people, this is kind of where vitamin therapy and what you mentioned with vitamin D comes into play, is that what people don't really understand on a neurological level is ultimately telling your muscles what to do is what's telling your muscles what to do is your brain. And your brain is sending out signals to the airway muscles, because while you're sleeping, you still make saliva and you have to breathe. So swallowing and breathing are supposed to stay active while you're asleep. And what regulates that is your brainstem. Your brainstem sends signals to these muscles to keep them active or keep them depressed. And what happens with vitamin D is vitamin D regulates this function and stimulates these cells in your brainstem. And it's literally like a central nervous system issue where the muscles are not getting the signals they're supposed to. And instead of the muscles staying active, they relax. And with some people, especially kids that aren't really kind of far down the spectrum of sleep apnea, a lot of times these parents will say that, oh, I have my 1-year-old snores and grinds their teeth, my 2-year-old snores and grinds their teeth. And when they see their physician regarding this, they don't really have a good answer for what to do. And the amazing thing is that when you catch this early on, simply just supplementation fixes the issue, and allows the brainstem to work how it's supposed to, and allows the brainstem to send out the correct signals to these muscles. So really, that's kind of the main things. All the other stuff kind of stems from this, but really it's structural issues play a role, but in my opinion, a bigger role is played by the central nervous system and what it's doing or not doing. Yeah.
Oh, Gary, you're muted still.
I'm so used to muting myself. Sorry, guys. So what's interesting here is that these vitamin deficiencies play a role, especially in children, but certainly in adults. And again, kind of connecting it back to really our mission with Sapien is to really educate people that this is because of bizarre, weird lifestyle that we lead, by having lack of sun exposure, by having a food system that's depleted of B vitamins, magnesium, and other micronutrients. You get deficiencies, and these deficiencies are very difficult to measure on blood work. They're highly unappreciated in the general medical community. In fact, vitamins in general, unless you're in our kind of alternative medicine space, are thought to be ineffective or not do anything. And again, just you can't make money. Pharmaceutical companies can't make money in vitamins. So it's not interesting to teach people about vitamin D and B vitamins and magnesium. Very, very simple, inexpensive, essential micronutrients and prohormones and things that you would otherwise obtain from a normal Homo sapien lifestyle that we just haven't lived for honestly hundreds, if not thousands of years. We're so disconnected from it. People forget the kind of life that people used to live. So we talk about that a lot. So I'm going to let that go. What I think is most interesting in getting to the meat and potatoes of this discussion is sort of what me and Dr. Gabe see in the clinical setting, what tips us off to making a diagnosis. And then I want to get into some of these cases that have just been so exciting for me and Dr. Gabe to just see transformational stories from essentially simple interventions. So one of the things we were talking about before the podcast was the sleep questionnaire. So you can essentially make a diagnosis of sleep apnea from this questionnaire because there's so many correlated behaviors. And presenting symptoms with sleep apnea. So, Dr. Gabe, can you get into some of the some of the sleep questionnaire information we talked about?
Sure. Yeah, absolutely. So, in my journey with apnea, I came across this questionnaire called the Lambert questionnaire, and it was put together by a dentist actually. And what they did is they went through a lot of published studies and a lot of the information out there regarding what are the comorbidities of sleep apnea, what typically co-presents with apnea. So this is based from actual studies, actual data, actual information, and they put it together in the form of a questionnaire. And I have found this to be a very invaluable tool. All of the patients you have referred to me check quite a few things. So really, ultimately, the sleep test confirms our suspicions, but at this point, after seeing enough of this disease, um, just the information I get from the questionnaire and talking to the patient regarding how they feel, I can usually tell even kind of the severity and if they're going to be UARS, if they're going to be sleep apnea. I can usually tell kind of where they even fall just based on that. So if you, it's a fairly lengthy questionnaire, but I'll just kind of go through it real quick, touch on a couple of things. So
And
it's broken. Yep.
really quick, Dr. Gabe, for those listening, it's the Lambert questionnaire. That's Lambert.
ERG, Lambert.
Lamberg questionnaire. And so people,
This is a tool for clinicians, but
yeah, but I think,
You can Google it and find the info. Absolutely.
yeah, we have a pretty savvy audience. And I think, one of the things they love to do is listen to the podcast and then look this stuff up. And we encourage
Absolutely.
people to do that and we love it. So yeah, feel free to look it up, but certainly a tool to be interpreted by a health professional.
Yeah, absolutely. I mean, the people interested, they can find the questionnaire, and if they feel like they have issues, I'm fairly confident they're going to notice quite a few things that they can relate to on the questionnaire. So they've broken it down into systems: cardiovascular, pulmonary, gastroenterology, neurology, endocrine, urology, because all these systems get affected by issues with your sleep in different ways. So the basic standard questions we ask are: do you feel tired during the day when you wake up? Do you snore? Has anyone told you stop breathing in your sleep? Um, Cardiovascular, the things that we'll touch on, some of the patients we've treated, obviously one of the main ones is hypertension. Some of the other things we know that are linked are AFib. That's a very, very distinct correlation to sleep disruption.
And AFib is
Elevated,
an irregular heart rhythm that is pretty common in medicine. And oftentimes, like hypertension, which is high blood pressure, they're said to be idiopathic. Oh, we don't know why it's caused. Well, sometimes me and Dr. Gabe can figure that one out.
so AFib is very commonly caused by airway obstruction. Elevated cholesterol. Your body does all the housekeeping during deep sleep and REM. A lot of the hormones and enzymes and things like that are made. So it's very, very common for people that have sleep disruption to have hormone dysregulation. It can depending on your genetic weaknesses and genetic makeup, it can manifest in different ways in different people. The elevated cholesterol is typically men above 30, 40. You would probably agree, right? Um,
Absolutely.
Pulmonology, difficulty breathing, shortness of breath, COPD, asthma, chronic cough, postnasal drip, things like that. Gastroenterology, acid reflux is a big one. Basically, what happens with acid reflux is when the person is trying to take a breath, your diaphragm and your rib muscles move. But if there's restriction to the air coming in, there is negative pressure that's created in the thorax. And the only way that the body can kind of equilibrate that negative pressure is by the stomach contents coming up into the esophagus. And then, depending on where the stomach acid goes from that point determines the symptom. Stomach acid could go down into the lungs, and when the apnea is milder and the reflux is milder, people will have asthma-like symptoms or asthma. When the reflux is very, very, very severe, people will get hospitalized with pneumonia multiple times, and they never really figure it out. They give them antibiotics, they do this stuff, but they're not really looking at a sleep test because it's really all that stomach acid going into the lungs that's causing the pneumonia.
Mm.
Um, um, Dentally, there's with reflux, there's erosion, right? And one of the things that we see, or I see, is wear and recession on the inside. Typically, people get recession on the outside of the teeth, but with people that have apnea, basically what happens is the stomach acid comes up, weakens the teeth. People will often have a large tongue due to the apnea and tongue thrusting. So it's actually the tongue rubbing on the insides of the teeth that have been softened by acid from GERD that causes this wear pattern. So we see things that happen in the teeth. Neurology, often um, muscle weakness, coordination, and neuropathy, tingling in the hands and feet, things like that. Endocrinology, obviously, like we mentioned, there's going to be a lot of issues with hormones depending on the person, because during sleep is when all this stuff is happening. So cholesterol we mentioned, diabetes is another major one, um, and repetitive limb movements, restless leg syndrome, these sorts of things from the body being in a chronically overdriven sympathetic state. So your flight or fight is basically overstimulated, and that spills over into the daytime and how, kind of what you do with your body. um Otolaryngology, ear, nose, throat, obviously, like we mentioned with the acid comes up. Postnasal drip largely is because of reflux. So what happens is the acid aggravates the mucus secreting cells, and you get constant chronic mucus secretion. It can cause recurrent sinus infections because the acid comes up into your maxillary sinus. It can go up your eustachian tube into the ear. Studies they've done, they've actually found H. pylori, which is a bacteria normally found in the stomach, in the sinuses, in the middle ear, in the lungs, all these places that the stomach acid is going based on what it has access to. Urology, ED. So ED is typically more in older men with fairly severe apnea. Again, it's a hormonal issue. Literally, I have had patients that have struggled with ED for years. We usually at that severity they would be getting a CPAP, but literally one day with the CPAP, the ED goes away. Um, uh, Frequent nighttime urination. When you are in deep sleep or REM, your body makes an antidiuretic hormone. So you don't wake up. Think about it evolutionarily 20, 30,000 years ago. If you made noise at night, you would give away your location to the predators and they would come eat you, right? So it's a disadvantage to move around, make noise at night. Um, you know, we live different now, so that's not really a factor, but your body not making enough of that antidiuretic hormone causes people to get up sometimes 4, 5, 6 times a night to pee. Um, what else? Psychology and psychiatry. Irritability in the morning. So think about it. Your body is, the analogy I give people is like if you almost get in a car accident, but you avoid it just by literally in a split second, your heart beats like 160 beats per minute. So it's a very, very severe fight or flight response, but that happens on a much lower chronic level at night. So when your breathing is affected, there's a physiologic response from your body. And if your body is in a chronic state of flight or fight, when you wake up in the morning, how are you going to feel? You're going to feel terrible. You're going to be irritable. You're going to be tired. So how you feel in the morning is a big one, because if your sleep is great and all of these things are in place, you should wake up rested and feel good. If you don't wake up rested and you don't feel good in the morning, that on its own tells you that there's a problem with your sleep. Insomnia definitely can be related to apnea, and how that works is when your body is in this chronic state of flight or fight. Eventually, like, you figure out your sleep positions and you go, I feel better, I sleep better in this position. Your body figures that out as well, and it knows, hey, I'm about to go to sleep. I'm going to be fighting and struggling the whole night. I don't want to go to sleep. So insomnia can often, it can be for other reasons as well, stress, all this stuff, but there's definitely a big correlation with insomnia and UARS and sleep apnea. Rheumatology, definitely chronic inflammation, RA, all of these things are linked. We have successfully treated and gotten people off of Humira and other medications by treating their sleep. Um, Headaches, so CO2 buildup, um, uh, clenching and grinding as a result. People will typically will have pain right here, your temporalis muscle, from clenching and grinding. Migraines, things like that, again from CO2 buildup. And dry mouth. Dry mouth, people have nasal issues, deviated septums, their mouth breathing. Often we'll even see inflammation. People will have healthy gum, except the front 6 teeth on the top and bottom, because the gums dry out and they're constantly breathing through their mouth at night. So we'll even see patterns of gum disease when someone's a mouth breather. And as we've discussed in previous ones, breathing through your nose is very important. Your body makes nitric oxide, which is a vasodilator, increases your oxygen absorption. So that kind of touched on the different systems and the different things it can cause. So literally just this one questionnaire, people fill this out. If they're struggling with their sleep, there are going to be some of the things that they recognize and that they check. So it's a really, really, really valuable tool.
And the takeaway anyone listening to this should hopefully understand is this is a root cause problem of chronic issues, chronic medical conditions like diabetes, but also just chronic nagging symptoms like headaches and urinary symptoms. And again, in our world of Western medicine, we are interested in treating a disease or treating a symptom. And why I think it's so important to educate people about this is a root cause solution to many, many problems that is highly underappreciated and underdiagnosed and undertreated. So thank you for going through that in detail, Dr. Gabe. I want to add to that some lab and sort of clinical findings, and then we're going to get into some of these cases because they're going to illustrate what we're talking about far better. When I'm looking at a metabolic pattern or I'm looking at a patient, one of the things I've started to really become aware of is hemoglobin levels. Like everyone's worried about anemia, having low blood counts, right? Anemia is low hemoglobin levels, often tied to nutritional issues or just bleeding issues. But what people don't worry about is when you see that hemoglobin at the very, very high side of normal or even above normal. And even in my training, no one really explained to me the importance of that specific finding. And what I'm noticing with a lot of my patients, when they've kind of optimized their diet and they've gotten on some basic medications for high blood pressure, and I start analyzing their blood work, and I see these hemoglobins, 17, 17.5, 17.8. And the reason why those are high is because they are hypoxic during sleep, and as a result, the body creates erythropoietin, which increases our red blood cells. This is a bad issue because it can increase your risk of stroke, blood clots, and a variety of issues. But just something that's grossly underappreciated. Um, and then fatigue. I kind of wanted to bring this up specifically. I just see so many patients complaining of fatigue, and it's like, well, you know, go to sleep more, or let's check your hormones and start hormone replacement therapy, or go work out. When in reality, fatigue is just it can be multifactorial, but it could be sleep apnea. And you can work on your sleep hygiene all you want. You can do all these different maneuvers, but ultimately, I have lots of patients that try everything. They continue to be fatigued, and this is the cause. And some supplementation, a bite guard or a CPAP can be a life changing
Yeah.
intervention. So those are the main things. So I want to get into some of these symptoms. Let's pause. We can
Yeah, we
clip
can.
it.
Well, we're just having some technical problems.
Okay.
Yeah, I don't know. I guess I can. I can. Oh yeah, Dr. Gabe, you can turn your camera back on. Just hit the icon.
Sorry, I didn't
Okay.
know what was happening.
My bad. Sorry. Okay, guys. Yeah. So I don't know too much about the hemoglobin. I'm kind of learning from you.
Well, hold on. Let's reset because we just
Okay.
Brian, we're
Oh,
good.
you just
Yeah,
stopped
yeah,
it. Okay. Cool.
you can just start back up.
Beautiful.
Well, Gary, you went
Yeah,
on to
so I'll go.
something else.
So this issue of fatigue is an interesting one, but I think that some of these case presentations that me and Dr. Gabe have worked on together will illustrate a lot of the issues that are interesting to us and will be interesting to you guys. So let's get started. So this is first case. I'm going to use fake names as usual, but these are real patients. So I got a 56-year-old guy, really healthy, exercises a lot, eats a pretty clean diet, but complains to me that, hey, doc, continue to have high blood pressure, won't go away. I'm working out, I'm taking, one or two meds, but it's still a problem. Then he tells me, fatigue was my primary problem. And about 6, 7 years ago, I reported fatigue and I got started on testosterone replacement therapy. I asked him to look at his blood work from back then, and he wasn't really very low in his testosterone. At least it wasn't a level that would trigger me to say that this fatigue is from testosterone. But nevertheless, he started testosterone at that time. Um, he continued to complain about fatigue. He also complained about a little bit of abdominal belly fat despite his best efforts, despite working on his diet, despite working out all the time. He just couldn't get his fasting insulin, his morning fasting insulin low. It was like 8, 9, 10, despite all his efforts. And his blood sugar actually wasn't that high. So his A1C, his marker of blood sugar over the 3-month time span, was pretty good. So there was a disconnect. This is important. There's a disconnect between fasting blood sugar and A1C and the fasting insulin levels. So you have this insulin resistance pattern without high blood sugars. You have this abdominal obesity in a setting of a skinny guy that could point towards like a low testosterone, but I know that his testosterone is replaced. So this abdominal obesity likely related to insulin resistance, which we've talked about before. So what's going on with him? He doesn't report snoring. He doesn't report per se not feeling well rested, but he's always tired. And so I step back and I'm like, look, come see Dr. Gabe. I know you don't have sleep problems. Let's just do a sleep apnea study. Let's just make sure that testosterone that was started 6 years ago was not started for the wrong reason, or it was started for the wrong reason. You guys get it. Like, my suspicion was this guy was presenting with sleep apnea in his 40s. He was empirically treated without a formal diagnosis of testicular hypogonadism or low testosterone. He continued on that. He had even changes in his echocardiogram related to his right heart pressures. So, the extreme of which would be pulmonary hypertension or right-sided heart high blood pressure, for layman's terms. But there's all these little things, and the so anyway, I thought it was very interesting. Dr. Gabe, what do you think about that case?
Yeah, it is very, very common that people feel like they sleep well. Um, People feel that they don't have issues with their sleep, but like you said, they're tired. And I think part of it is um, again, like we mentioned, UARS, right? So this starts very, very small. And basically, by the time people are at this stage, they usually have dealt with this problem for many, many, many years. And what basically starts to happen is people get used to how people get used to feeling shitty.
Mm-hmm.
And they don't realize that that's not how it's supposed to be. And that was me as well. I didn't know. I just, if I slept my 8, 9 hours, I kind of felt okay with caffeine, but I didn't really know because just that's all I knew is how it was. So, and another common misconception is the snoring. So very often people don't people don't snore, but they have airway obstruction, and the two don't necessarily go together. But whenever you have weird stuff like this, it's very often when all these other things have been addressed, very often it is the sleep. And another thing people need to understand, all humans are predisposed to apnea. And the reason for that is because we walk upright. So if you look at any animal that walks on all fours, the nose, the trachea, and the lung is a straight tube, right? Because you're looking forward. It's a straight line. By us walking upright, there's a 90-degree bend in your neck. So there is a natural anatomical point of obstruction for everyone. And, vitamin D, we mentioned, it is a um, epidemic, I guess you could say. So you
Totally.
combine these factors, and sleep apnea is one of the most, if not the most, undiagnosed conditions. And I think it's fairly safe to say that anybody in their late 40s, early 50s is gonna have some degree of this. Because look, even your patients who are following all the rules, the Sapien diet, they're doing their vitamins, they're doing everything right, still having issues. So imagine the person that doesn't do those things, where they would be by the time in their 50s. But because you've lived with it for 20 years, you don't know what it's supposed to be like. And I'm going to just reiterate, if you don't feel great in the morning when you wake up, there's a problem with your sleep. Just as simple as that. So hypertension is definitely one of the big things that we see, Gary and I, and resistant hypertension. And it's specifically with, not with everyone, but with a lot of people. What people will notice is that their blood pressure will be high in the morning after they wake up, and by nighttime it's normal. And the reason for that is, think about it. If your body is in a state of flight or fight and hypoxia the entire night, what is that going to do to your heart? It's going to stress your heart. And what the chronic hypoxia does, your body has sensors in your carotid arteries for oxygen content. And what happens is, as your oxygen level starts to drop, your body increases your heart rate to compensate. It compensates for the lack of oxygen in the blood by speeding up the flow so you could deliver more, even though there's less oxygen. So very, very, very directly it stresses the heart. And very often with these people, it's going to be resistant, because the issue is solely their sleep. That is why it's high in the morning. Their body is fighting the whole night. You wake up, the heart is stressed, blood pressure is high. By the end of the day, you're not sleeping. So the heart can return to semi-normal function by the end of the day. Blood pressure comes down. So it's very characteristic of apnea.
Yeah, and that just brings us to our next clinical case. And I just think this idea of resistant hypertension, or actually just hypertension or high blood pressure that is not responding the way uh, is expected to medications or lifestyle changes. And then also the pattern of high blood pressure, specifically that morning elevated pressures that normalize in the end of the day. I'll bring up this next case. This is a really great guy. He lived a hard life. He partied a lot. He was in the music industry, whatever. But he cleaned it up, and over 10 years, he leaned out. He didn't do any smoking. He was just doing great. He looks awesome. This is a guy in his late 50s, muscular, fit looking, but he came to me because he's like, Gary, I've been following the Sapien thing. I've been on this kind of low carb, sort of ancestral health approach for the last 10 years, but my blood pressure just is high. It's just high every morning. I get headaches, and every time the doctors try to treat me, I feel really, really bad because no one ever monitored his blood pressure over the course of a day. So basically, they would see these morning blood pressures. He'd go see his doctor first thing in the morning. They'd be super high. They would treat it. He'd come back 4-6 weeks later. It's still high. They would treat it more. Then he'd feel really, really bad. He'd come back with high blood pressure and they'd say, oh, let's try a different drug. My drug's not working. Instead of looking for a different cause of this high blood pressure. So when he came to me, I said, okay, your blood sugar is great, your cholesterol is great, your testosterone is great, your vitamin status is great, your BMI is great, you look the part, you're doing all the things. He was teaching me about the Sapien diet. I was like, this is awesome. Mm-hmm. So I stepped back and I said, what is missing? So I'm like, okay, let's get some objective data. And I asked him to do blood pressures throughout the day. So first thing in the morning, in this case, I was even like, give it to me 4 hours later, 4 hours later, 4 hours later, kind of until he goes to bed. So I wanted to get as much data as I could because this was a smart guy. He was like super motivated. And I wanted to present to him like, look, this is what I see. So what did we see? Despite on drugs or off drugs, and we did both. He would take medicine for a while. Then I said, stop the medicine. Let's see. It didn't matter with or without the medicine. His blood pressure was crazy high in the morning and steadily came down. He had caffeine at lunch, popped up, and by the time it was the end of the day and he was winding down for sleep, he had exercised, the whole deal. He had normal blood pressure. So what happens when you give someone with normal blood pressure medicine? They feel like crap. Their blood pressure drops, their kidney function changes, their heart rate slows depending on which drug you use. It's bad. You feel horrible. So then we tried like morning medicine, and he actually felt okay taking some medicine in the morning that was short acting, and then by the afternoon. And then through all that data, I then said, oh, by the way, sir, you have this hemoglobin that's pretty high. It wasn't crazy high, but it was over 17. Let's just go get a sleep study. And he was so resistant to it. He's like, I don't want a CPAP. I don't want anything. I take all my supplements. I'm like, but look, this could be a root cause problem. So sent him to Dr. Gabe. Dr. Babe did the assessment. I think it was moderate. Do you remember?
Yeah, mild to moderate.
Mild to moderate.
Was not, yeah.
It wasn't crazy, but it was there. Got him a bite guard, which is a dental appliance. And
not a bite guard, but yeah.
What did you do? Oh, dental appliance.
Yeah,
it looks like a bite guard.
Looks like a bite guard. Yeah, but
looks. Why don't we do it? Let's tell everyone. So not a bite guard, but looks like a bite guard. What is it exactly?
So a bite guard, a night guard is for grinding, and all it does is it goes on one arch, and it gives you a layer between the two teeth. So you're grinding that instead of grinding your teeth against each other. An appliance for treating sleep apnea or snoring. It's basically, imagine two bite guards together. So there's an upper and a lower, and there's many different designs, but in essence, they're connected in some way to keep the lower jaw from retruding and falling back all the way. So that takes the tongue and all the soft tissue off the back of the throat and creates more volume where you need it.
Amazing. And this is the intervention that me and Dr. Gabe are trying to promote, because so many people don't even want to get a sleep study because all they think is CPAP, CPAP, CPAP. Then they figure out, oh, there's a supplement component. They supplement, supplement, supplement. But even that, there's a lot of misguidance. So, even with that component, we're guiding people how to take your supplements specifically. And that's different for different people. So we're not going to get into that. If you guys are interested and you have questions, specifically, come see us, reach out to us on social media. I don't want to give general guidelines because there aren't general guidelines per se. Maybe Dr. Gabe wants to throw some out, but I rather make people aware that there's this component of supplementation, there's this promotion of the CPAP, but there's this other intervention which is far less intrusive and highly effective. To finish that case, I get a call 2 weeks after he starts the bike guard. What the hell, Gary? I don't have high blood pressure anymore. In fact, I was taking my medicine going into it. I started getting dizzy. I stopped it 3 days after using my bike guard. I haven't had high blood pressure since. And that is a pretty amazing story. I think because it was a very, very simple observation and one that is unappreciated. And when I was in medical school, we were told something like 80% of high blood pressure is called idiopathic. Idiopathic means we don't know. My guess, vast majority of that blood pressure actually related to sleep issues. And again, why is sleep not a bigger deal in medicine? Why did, just really in the last few years with this, is it Walker came out with that
Matthew
book, how
Walker, yeah,
Matthew
Why We
Walker,
Sleep.
Why We Sleep. Read that. I read it. It was awesome. But my point is why is that only now becoming interesting? We had a culture of I'll sleep when I die. We had a cultural problem with sleep when it turns out that we have evolved to make sleep a central part of our lives. And you're going to be highly effective if you sleep well, and you're going to suffer and be chronically ill if you don't, on a simple level. So, you know, I wanted just to review. You have resistant high blood pressure. You have not true high blood pressure, where the blood pressure is high in the morning and then the afternoon, misdiagnosed, actually sleep apnea. You have a patient with quote unquote low testosterone that's not improving with testosterone, whose fatigue and original presenting symptom was actually sleep apnea. And that same patient had a disconnect between their blood sugars and their morning fasting insulin, as well as this issue with elevated hemoglobins. All of these little pieces, these little puzzle pieces, is what we're putting together to encourage people to go get a sleep study. And in my opinion, I think a sleep study should be part of an annual physical. I
I
think
agree.
that it's become inexpensive enough. It's become easy enough. Everyone comes in, you're getting your annual physical. I slap an EKG on, I get your annual blood work, and I should be sending you home with a little finger machine that's going to send your sleep results to us. We're going to review it, and that's going to be part of a yearly assessment. I think we would have a profound effect on the
Mm.
general health of our population if we started doing sleep studies. Go ahead. Sorry.
Absolutely, that is one of the things in the amongst us people that treat and understand sleep is we have always pushed for exactly what you're saying, and you and I haven't maybe we've discussed it. I don't recall, but you came to that conclusion yourself. And in our community, we basically have always advocated that a sleep test should be part of a physical, and it should be something that is done routinely like any other blood work, because why wouldn't it? If this one thing can affect every single system in your body, then it wouldn't it make sense to assess that before doing all these things? And that's a lot of people don't fit, like we said, the Pickwickian syndrome, and a lot of people don't fit. And I had no idea I had sleep apnea, and if it wasn't for a happenstance, me taking a sleep test, I probably still wouldn't know what was wrong with me.
Yeah.
But it absolutely is important. And part of the resistance from people comes from the fact that you're asleep and you're not aware of anything going on. So unless you're already symptomatic, unless your bed partner is telling you you snore, or where you feel like crap, people are going to be kind of resistant to saying they're broken and that they have a problem. And even with the last gentleman you mentioned, I know it took a bit of work to get him to finally come in. And look, like his results were great, but he was very, very resistant. And do we have still have time?
Yeah, Brian,
Yeah,
you wanted to say something?
yeah, I'll throw in some stuff. I wanted to reiterate a few things and share my experience really quick. Because 10 years ago, I got a sleep test and I had to go into the center and it was a nightmare and I had to sleep in this weird bed. And yeah, it was terrible. Also, yes, you don't know. You think it's related to being obese and you're always resistant. I was resistant too. It's like, I don't have a sleep problem. I don't have a sleep problem. So this is such a big thing. I'm kind of trying to talk more about it, how important sleep is to all the pillars of health, because we always focus on nutrition. But more and more, I'm finding that sleep is one of the biggest things ever, so huge. And what I do most consistently, I realize that I'm more consistent with my sleep than with how I eat. Because I still go, oh, we're on vacation, I'm not perfectly consistent with my food, but it works for me. I bounce back easily. With my sleep, every night, I'm there 8 hours at least. It's huge. I think that's why I don't get sick. I've seen other really healthy people, they let up on their sleep, boom, they get sick. They did everything else right. The healthiest people I know let up on their sleep 4 days in a row, traveling, boom, they finally get sick for the first time in 10 years. So super important. And it goes beyond just being in bed for 8 hours, because I found that as well. Oh, I wasn't getting restorative sleep. You could think you're getting restorative sleep. You're not. You need to do the test. Super easy. Get the finger thing. You go home, do it. It's not very intrusive and you can get a lot of data. So I wanted to throw that in. And yes, we do have about 5 more minutes if you want to talk about one more case study.
I want to wrap two cases up in one. This is actually, it worked out pretty great. Actually 3 cases in 5 minutes. First case, and this is just, I want to point this out. 40-something-year-old female has anxiety, depression, doesn't want to do drugs. Tried drugs, didn't feel good for her. A lot of my patients don't want to be on medications. A lot of these medications do nothing. I looked through all her blood work. Again, I can't remember exactly, just caught a high hemoglobin. I'm like, what is a menstruating lady doing with a high hemoglobin? And the reason why I say that is if you're bleeding every month, if anything, women suffer from iron deficiency anemia because they're bleeding all the time. She has normal periods, all that stuff. And I'm like, why is it like 17? Again, just one of these things. I'm like, it makes no sense. Referred her to Dr. Gabe, took a lot of convincing. There it is, sleep apnea presenting as depression, anxiety. Root cause problem. Next 2 cases, since we're running out of time, I just want to point this out. I've had, and again, I'm going to thank everyone for all of the lovely Sapien consults from all around the country and world. And one of the things that I'd like to bring to the table is, look, if you're eating clean, you've reversed your diabetes, you've cleaned up your diet, your lipid panel looks beautiful, your CRP is low, and you're still suffering. You're having headaches, you're feeling fatigue, you're not quite there, you're having some cognitive slowing. Think about sleep apnea. I had an 80-something-year-old guy come in, reversed his diabetes, all this stuff, still couldn't feel great. And I was just like, what is missing? Turns out he had moderate to severe sleep apnea. I think he ended up with a CPAP because it was so bad, and it was later in his life, changed his life, immediately started feeling better. Very dramatic story. He's an amazing guy, really an amazing guy. And if I can get him on this podcast to share his story one day, I will. Just working on that. There's some other issues going on. Flip side of that coin, 30-something-year-old guy doing the Sapien diet, running a ton, all this stuff, just killing it. Looks great, even felt great. I think his primary issue was he had these intermittent headaches, and they would come and go, and they were weird.
Morning specifically.
Morning specific.
Every
Morning specifically. And I'm pretty sure I'd seen him a few times, and I kept trying to figure out what it was. And I think that week I had a conversation with Gabe about like headaches and migraines, right?
I met him in your office. I happened to be there for IV therapy.
Yeah, Gabe was doing, I think, some NAD plus infusion. Yep. And anyway, somehow it came up with the headaches, and it was like, bing, bing, bing. We got to test this guy for sleep apnea. He had no reports of sleep issues. I don't know how that questionnaire turned out, but anyhow, It was like mild to moderate sleep apnea. He started the mouth guard. He came back glowing, like, oh my God, Gary, what? This is so surprising. I've never felt so great. I already felt great. I feel even better. The reason why I bring this up to everyone is our goal is to create an expectation that you should feel great. This expectation, this new baseline of I feel pretty crappy, but I'm okay. No, that these three guys on this podcast that we're trying to teach you, you should feel great. And if you don't, there's work to be done. We can figure it out. If you get the right providers, if you get the right education, if you really, really dig into what's going on with you, honestly, truthfully, not resistant to some misconceptions you might have about health, you can get yourself feeling great. And that doesn't happen with just one doctor. It doesn't happen with one Instagram influencer, and it doesn't happen with one dentist. It happens by understanding your body and gathering all this information, because a lot of you might not be able to come and see me or Dr. Gabe. Um, you can still learn and find these patterns and pursue some meaningful interventions and get off drugs and just be your best self. I truly believe that. I see it happen in my clinic every day. I am so grateful for Dr. Gabe and Dr. Joel Gould, we should mention, who was a huge inspiration, I think, for all three of us to teach us
Absolutely.
about so many of these issues. You can listen to season 1 Sapien podcast where we had Dr. Gould on. He's an amazing guy doing some really special work in the space of educating children with this stuff. So anyway, shout out to Joel. But this is huge. If this doesn't resonate with you, but your spouse or your sibling or your family member or your best friend, and you're listening to us and you're like, whoa, that looks like my buddy or my, whatever, my husband or my wife, bring it up, educate people, because this is a life-changing concept for many, many, many people in this world.
And it's one of those things that people don't make a lot of money on, and so
Exactly.
that it's never going to be addressed. There's not like big mouth guard, that's going to make billions of dollars off these mouth devices. So it makes sense why we don't know about it. But yeah, I'll let Gabe wrap it up here. Anything else you got?
Yeah, that's you're absolutely right, and that's one of the reasons why physicians are not educated more on sleep, because there's no money to be made, unfortunately. But there are. It's difficult to find, but there are providers out there who think different, such as Gary, such as myself, who really, our goal is to get our patients healthy and feeling great. That really what drives us in general. And there are people out there. If you do not have access to coming here, there are other people out there that can help you, that think in a similar way. And I just want to reiterate, um, the vitamin therapy and the sleep treatment, they go hand in hand. And the way that works is that, once your body's broken down and it has all these deficiencies, because you mentioned a couple of patients, they're taking the supplements, they're doing all these things. So the problem is that their body is already sick and broken down. The vitamins will be a starting point and some help, but ultimately how they're going to start getting better, how the hypertension will reverse, how all these things will happen is when they get into the stages of sleep that do the work. And the propping the airway open, whether it's a CPAP, whether it's an oral appliance, allowing you to breathe at night and replacing the missing elements work together synergistically. And they're both needed to get people well. Because I know lots of people who are on a CPAP, not doing vitamin therapy, and they still don't feel good. They still don't feel great. It's because they work together, and you have to do both if you want to actually get better and not just stay in a disease state and not die. If you want to actually reverse your health and improve it, you have to do the whole thing. You have to do the diet, the sleep hygiene, the keeping the airway open, the vitamin therapy, everything works synergistically together.
I love
And
it. I
it's
love it. What's your website, Dr. Gabe?
ModernAmericanDentistry.com.
Awesome. And Gary is evolvehealthcare.com. You got any last words, Doc?
it's not that hard. It's a lot of components, it's a lot of pieces, and it's a lot of re-education, but it's not that hard. Once you figure it out, the quality of life improvement is so dramatic. Every bit of effort is rewarded to you through an amazing transformation of your body and your mind.
I
And
think that I think the biggest thing is a level of trust. When your provider, um, Dr. Gary, when they think you should try something, and it goes the same with us how we practice. If I wasn't open-minded, I never would have discovered any of these things. If you think you know and you're in this, you think you know, and has to fit in this little box, you're not going to grow and evolve and improve. And as practitioners, that's how we get better. Is we have to be open-minded to new ideas. And I just implore the patients to do the same. Trust your provider and be open-minded. Give it a try, because some of these patients, if they didn't break down and listen, it could have been another 30 years of misery and illness. Think about it. You know, you change these people's lives. And, like I said, it just requires a little bit of trust.
And yeah, this is the biggest bang for your buck. It sounds like you can get, right? It's like just
Absolutely.
it's not that big of an investment, and it could change the rest of your life. So
Yeah.
go to the websites modernamericandentistry.com, evolvehealthcare.com, sapien.org is our main site. Thanks for listening, everyone.
nosetotale.org. Let's
Oh,
not forget
nosetotale.org. Get your
nosetotale.org.
meat, get your other stuff, your body care products, your biltong. Thanks for that, Gary. And yeah, we'll see you next time.
All right.
Thanks for
Thanks, guys.
listening.
Thanks,
Thanks,
guys.
Dr. Gabe.